The member for Ottawa-Orléans.
Thank you very much, Mr. Speaker. My questions for the Premier. Children's hospitals across Ontario are facing unprecedented challenges. In Ottawa, CHEO is operating at 113% capacity, while its intensive care unit is at over 180%, Mr. Speaker. CHEO is cancelling surgeries and converting more space for that intensive care need. There are shortages in the lack of children's pain medications, which is forcing more and more parents to go to the emergency room to seek care for their kids. Under the watch of this government, Mr. Speaker, CHEO has had to cancel appointments and surgeries because of this influx of patients and the lack of sufficient resources to deal with the surge. They don't have sufficient resources, Mr. Speaker, because of Bill 124. They don't have sufficient resources, Mr. Speaker, because this government is fixated on election gimmicks instead of investing in our health care. The hospitals don't have sufficient resources, Mr. Speaker, because this government doesn't have their back. So, Mr. Speaker, what is this government going to do today to fix the health care crisis in our hospitals, in particular our children's hospitals?
Minister of Health.
So I'm going to start with the pediatric pain medication. I wonder if the member opposite has spoken to the federal government and talked about what they are doing to actually ensure that the pain medication that our parents and our children need and deserve is available in the province of Ontario. I know that I have been speaking to Minister Duclos on a almost daily basis to get updates, and I have assurances that that is happening. But I wonder if the member opposite has done the same. I wonder if the member opposite has actually congratulated CHEO on doing something that has added capacity in a very expedited manner. These are the leadership qualities that we need to encourage and make sure that we're acknowledging, we're funding, and we're supporting. We're doing that as our government is. I wonder if the member opposite has done the same.
Supplementary question.
Well, my supplemental is also for the Premier, Mr. Speaker. Almost every aspect of the healthcare system is in crisis. Under this government's watch, we've seen the time for ER visits, admitted patients increase to over 45.2 hours. We've seen ambulance offload delays go from 83 minutes to 90 minutes in September, Mr. Speaker. That extra 7 minutes is almost the entire provincially legislated time for response for an emergency, Mr. Speaker. This has led to a dramatic increase in level 0 events right across the province. That means an ambulance isn't there to respond to your 911 call. Despite the level 0 crisis we're facing, neither the word paramedic nor the word ambulance is mentioned one time, not once, in the fall economic statement, Mr. Speaker. The City of Ottawa is asking for $5 million to strategically position paramedics at hospitals across the city to help with offload delays. Will the government provide the city this funding to reduce level 0 events and ensure an ambulance is there to respond to 911 calls?
Minister of Health.
So in August, we passed a budget that had an increase in the health care budget of over $5 billion. The member opposite voted against that initiative.
Shame. Oh, wow. Shame. You voted against health care.
Government side.
You cannot stand up.
Order. The House will come to order. Minister of Health, please continue.
You cannot stand up and demand that we make more investments in health care without actually doing the work.